Hi, it's Dr. Jenn Kennedy. I'm a sexologist and couples therapist. The Pleasure Project podcast is about sex and relationships. So this includes discussions on desire, dysfunction, dissatisfaction, exploration of all things sex related. So sometimes I'll do toy reviews and we'll look at trends, and sometimes I'll also enlist other experts. We'll increase your insight and enhance your pleasure. So tune in. Hi, welcome back to The Pleasure Project with Dr. Jenn Kennedy. In this episode, I interview Dr. Evan Goldstein. He is an anal surgeon. He's also the founder of Bespoke Surgical and the founder of Future Method, which is a toy company. So really interesting interview. He is not shy about talking about all things anal. He gives us really practical tips about how to prepare the body, how to angles that are good, make, ways to make sure you're clean, sort of the anatomy and why it feels so good. Different things that, we don't even different people have different bodies. And he describes 3 different types of bodies that can allow different amounts of penetration. And so if you're not of the 1/3 population that has it easy, then you might have to do a little bit of preparation. And he's got a program that is set up for that. So we talk about all of this in the interview. So tune in, and I look forward to hearing your feedback. So welcome back to The Pleasure Project with Dr. Jenn Kennedy. My guest today is Dr. Evan Goldstein. Dr. Evan Goldstein is the leading anal health expert in the United States, founder of Future Method, and one of the few surgeons in the world who practice. Bespoke Surgical is dedicated to treating and restoring the human butt. He holds a perennial spot in the list of top doctors for the New York metro area, and Crane's New York business listed him as one of their notable LGBTQ plus leaders and executives. He has been featured in national publications, including GQ, Well and Good, Men's Health, Cosmopolitan, New York Magazine. Wow, that's a lot. Fast Company, Out, Shape, he's everywhere. And he's in demand as a speaker and for both medical and sex positive industries. His first book, But Seriously, The Definitive Guide to Anal Health, Pleasure, and Everything in Between, published in May of 2024. So welcome.
Thank you. Thanks for having me. I appreciate it.
Yeah, I'm excited to have you here. I've done quite a bit on this podcast for women, and occasionally we do a little bit for queer, but we don't do anything. We haven't done anything specific to anal. So I'm really excited to kind of have some attention paid to that part of the body. And also just to kind of get, I liked the levity in the book. You were direct and you were super informative and also playful. So that's
thank you. Yeah. Let's dive deep, literally.
So let's see. Okay, so first just tell us about you. How did you, I know from the book, but our listeners won't necessarily know. So tell us how you arrived here, both kind of personally and professionally.
Yeah, I never thought I would be playing with asses all day and every day. I started in heart surgery and I came out later in life. I realized that I was completely a homosexual and that I enjoyed all of these things. And I didn't enjoy cardiac surgery. I was really not in a good space in my life at the time. And I met my partner, Andy. We have 2 kids together. We've been together for 18 years. Our kids are almost 13. And so when I left heart surgery, I started to look at myself and all the things. And in the book, I go over what I suffered myself from an anal perspective, and then getting into the gay space, let alone the anal space, and then trying to figure out how to navigate that. And through that, you start to say, well, wait a second, why isn't there access to this type of care? Or why doesn't this care actually exist? And that went off in my head to say, I don't care if I'm fixing a heart, a breast, an ass. There's a need in a community, let alone the gay community, then even the anal community. And we'll speak to the differences between the male pelvis and the female pelvis and the nuances and why anal is now the amazing, on the rise and an amazing from a popular culture perspective. But I started Bespoke Surgical out of that need in a community to say, how do we provide access to care that is destigmatizing, that takes away the taboo out of the subject and meet people where they are. If you engage in X, Y, and Z, amazing. How do we just look at it and make sure that we're doing it as risk averse as possible? And if something were to go wrong, now you have access to a place that can fix it, that can get you into a good space. So that was really the birth of my surgical practice 15 years ago, called Bespoke Surgical. And then it started to take a life of its own, where you start to say, well, wait a second, people even aren't talking about sex. How do you start to first break down those stigmas, those phobias as a society? And then it started to go into, and we'll talk about products and the product company that I started and the reason why I wrote the book and all that stuff. But that's kind of
You're
the
as
start of
a
me.
physician, you're inheriting people that have kind of already been on the painful side of it or problematic side of it, right? So you're now getting ahead of it and trying to help people have healthy approach to begin with, right? Destigmatizing.
100%. Like what I see in the practice is a lot of people that have ailments, or they functionally can't engage anally because there's pain, there's bleeding, there's restriction. There are also people that come to me for yearly checkups and evaluations to make sure, because everything is going according to plan. And
Mm-hmm.
how do we make sure that that is the case? And
Yeah.
also people that want to get into anal but yet don't know anything about it, and they want to make sure. And we'll talk, because in the book we cover what type of ass you have.
Right.
But with that being said, there are definitely people. And then I stepped out of the practice to say, how do we educate the masses? How do we make sure that we do preventative strategy? How do we make sure that people are able to do what they want to do, but safely?
Yeah. I saw there was actually a quote in some of your materials that said sex education has neglected anal engagement. And I'm like,
Totally.
yeah. I mean, for people to even get sex education is one thing, but certainly sex education never gives any of the like rich information that you give. Like it doesn't really address it as an option for pleasure.
100%. I mean, I think we know that sex education is piss poor everywhere. And even now, with our country so divisive. But with that being said, that was the impetus of the book, which I was like, you know what? Like, I'm not going to wait to be able to go into high schools and talk about anal sex, let alone gay sex. That may not even happen in my lifetime. But if I'm able to put a book out there for parents, for educators, for practitioners, for people trying to engage, now we could start to say, okay, how do we hold science accountable? How do we hold the medical practice accountable? How do we start to kind of look at sex in different ways of pleasure? I try to take gay sex, I try to take anal sex
Hmm.
out of the vernaculum,
Yes.
because the second people think of that, they think of only one thing,
Right.
And the reality is that every part of everybody's body has
Hmm.
pleasure zones. And
Yeah.
how do you look at anal as just being an additive to the
Yeah.
sex that we have?
Right. It's just, right. We talk about erogenous zones. We talk about all the different places that feel really good on the body. And that is just another opportunity for pleasure.
Yeah, 100%.
Yeah. Um, so how has the book been received?
It's great. I mean, it's been, we've been doing a ton of podcast work. I've been,
Hmm.
written up on it, and things are really going well. I mean, I think that we're seeing a huge, first of all, anal is very vogue right
Mm,
now.
okay. So
Everybody,
mainstream media hasn't been squeamish?
no, I mean, I think that, getting on daytime TV to talk about
Yeah.
anal gay sex, that wasn't the intent of the book, even though I would have loved for that, but we knew that it's more of, again, looking at people that are sex positive and how to push
Hmm.
that into the narratives, and hopefully that the rest of the world is listening and watching, that we're able to say, well, wait a second, why can't it be on daytime TV to say, what if my son or daughter is engaging in these practices? How do I make sure that they're safe? How do we make sure that they have the access to this type of care? And how do we just allow them to be where they want to be safely? And I think it's coming, it is. It's definitely, you could see the narratives are definitely moving in that direction. It's just going to take time and more persistence.
Yeah, I mean, our culture is so strange in that way that we've got both this curiosity and this hesitation, judgment, sort of, right? It's a very prurient kind of culture that And yet it's not that people don't want it or they're not doing it. They're just not talking about it or owning it, you know?
Yeah, I think that we always see that mismatch, especially on sex or in many
Mhm.
different things, right? Of like, as long as it's not me, but it is you and you are engaging that way. But with that being said, I think that that's where with the book, we started out with the myths and the taboos in the first couple of chapters, which is to just be like, okay, if I take it up the ass, I must be a homosexual. And you're like,
Mhm.
well, no, yes,
Mhm.
you may be, but the reality is that most people can engage anally and still be in the heterosexual world as what they define. So again, I think it's looking at all of
Yeah.
those. Am I going to be too loose? Am I going to poop on my partner? All of these things that people think about. I think that that was what was so cool about the book, is that we decided
Yeah.
to just take it head on at first,
Right.
to be like, what
These
are
are all the
these?
things that people are thinking, so let's just like
Totally,
get them out
because that's what leads people into this, to be like, hey, I don't necessarily want to do these things, when the reality is that it is a pleasure zone and your orgasms are that much better by engaging anally, and we'll talk about that, I'm sure. But with that being said, you have to first work through all of the
there. Yeah.
generational bullshit that we all have from our
What do you
baggage.
feel like are some of the biggest misconceptions or myths regarding
Well,
anal sex?
yeah, I think first off is that if I engage anally, I must be gay or on the
Mhm.
spectrum of that. And that's a huge thing. I think when you look at it culturally, when you look at it religiously, when you look at that side of it, people start, especially the hetero male, has a very tough time with anal play,
Mhm.
and they define that, and they're like, oh well, I'll only do external play. Well, okay. And then like, oh, I'll do only a finger here or there, or oh, I will do full penetration, right? That's one side of it. The other is like, if I am engaging anally, I must be submissive. And you're like, no, you can still be taking it in the ass, but yet be in control and still be dominating. I think the nice thing about anal is that it calls into question all of sexual acts for you to
Mhm.
think about,
Mhm.
right? Everyone, because the
Negotiation of the
culture,
roles.
yeah,
Yeah.
exactly. And everybody defines something, but the reality is there really shouldn't be any definition. And that the definition that we all are taught is bullshit. And the reality is like, how do we start? And I always say this, how do you start to become comfortable with the uncomfortable? It's not that I want you in pain. It's not that I want you bleeding, but I want you out of your comfort zone, because if you don't do that, you won't understand pleasure and you won't know what works and what doesn't. And so a lot of that I think is really important, especially on the anal side, but it translates to everything, for
Yeah.
you to really understand that no, it's a pleasure zone, and there are pleasure receptors that will improve your sexual game and or your partner's sexual game. How do you try to tap into it within a degree of safety that you feel comfortable with, right? So
Right.
that's one.
And this also, I mean, I got this from the book, is that this isn't something you can just go at it and likely, unless you're a certain right type
Yes, 100%. So people
physically,
that
but
are
it takes a lot
listening,
of
that's right.
conditioning, takes some practice, it takes some
Yeah,
warm up. You have to prepare
that's
the
right.
body. And there is, just like many other types of sports or even vaginal sex, sometimes like it requires some preparation in the body.
100%. I mean, I think people, that's another myth. People think you can go from nothing to something big in your ass and you'll be fine. And you're like, well, wait a second. Let's take
Hmm.
a step back and understand that. I think the way that we spoke in the book was more for people to really learn about their own anal anatomy. And this again goes for all different types of sex that you're trying to do. I think the pleasure should be first sought by yourself,
Hmm.
self play, so that
Hmm.
you're able to understand your anatomy, and then you're able to understand what works and what doesn't and what feels good, and you're able to understand your pelvis. And why we talk about that anally is, we know, and we go over in the book, that there are three types of bottoms. There are three types of asses in the world. One, about a third of people can take whatever they want when they want. And that's because their muscles and their skin are able to fully relax and fully open. So when you think of anal anatomy, let's take a step back and think of, I want to have sex. I want to take it up the ass. How do I do it? And I've never done it before. You need to figure out what type of muscles you have and what type of skin you have. And specifically on a female perspective and or transitioning male to female, the estrogens, the progesterones, all of these hormones make the skin beautiful, but very, very thin. And why is that important? Well, we
Mhm.
have three sets of muscles in everybody's ass. Those muscles, we're asking it like an accordion to open and close. Those muscles do not function together. They're independent. We need them to open together. We need the mechanism to open and relax and close and open. With that said, you can learn how to control that. And when we talk about muscle and skin, some people are able to fully relax the muscles, but they're very restricted on the skin.
Mhm.
Meaning we need it to open, great, your muscles are relaxed, but yet your skin won't open to accommodate the toy, the penis, the fist, the whatever.
Mhm.
Okay, so when we talk about these three different types of asses, we're saying we know that there are three different components, and 2/3 of everybody will have some discrepancy in the muscle and the skin that may limit them with anal sex. So
Mhm.
when we talk in the book, we say, okay, if you come into my office and you say, I want to have anal sex, I say to you, okay, it's going to take you 6 weeks to do it. And the reason why is we're going to want you to use toys specifically designed for you to understand and learn which type of ass you have.
And that's so
Can
big
you?
if you're committed and consistent with the program. The
Yeah, and it's
understanding,
not a
right?
huge deal. People are always like, "Oh man, it's a lot." It's like, no, it's I do it when I'm showering two
Mhm.
times a week, and literally just like going to the gym, give me two sets of 12. And what you're doing is you're using the small toy. Now, I started a products company called Future Method. It's all about science and sex and everything that I learned in the practice. It's also what we learned in the book. And we did was I didn't see the products that were out there really specifically designed to get people from nothing to enjoyment. And I really said, you know what, let's really put out the products that make sense. So one of the products is a glass dilating kit, and
Mhm.
it's small, medium, and large. And what that does is, with the use of glass, with the use of the right lube, with the use of the right pressure, we're learning how to get those three muscles that don't work together. We're learning how to get them to learn to accommodate and relax. And it takes
So
time.
just a quick clarification. I know people are typically kind of hesitant about using glass. They think it's
Yep.
going to be cold and hard and kind of doesn't feel fleshy and what they're used to. What? Tell me.
Yeah, so first of all, a lot of the others, whether it's silicone and or rubber or some of the others, they don't pick up the lube as great. So
Mhm.
there's a lot of friction with that type of a toy. Also, when you're looking at engaging with muscle, think about if you have a knot in the back of your neck, how much the masseuse needs to bang that muscle in order to get it to relax. It's the same concept anally. A lot of the other toys are just too soft that you're engaging it, but you're not actually engaging it correctly. Second, this glass won't break, so don't worry about that. Second of all, the lube, I like silicone based lube just because it's the best from an anal perspective, but
Mhm.
you can use whatever lube you want. This type of material is so easy to clean. You can boil it, you can heat it, you can freeze it, you can do all these different things if you wanted to create other effects by using it. So I think when you're talking about where we are to get the muscles to learn to relax and to function, I find glass to be the best. But you don't need to use my products. You can just use the concepts. If you have something that's out
Sure.
there that you feel works for you, then just understand what the process of what we're doing and why.
Well, and
And
I
that I
like that
think will help.
you've got these toys because the other thing is that typically, women own a lot of toys, but they aren't necessarily suitable for the anus, right?
Yes.
It's a different structure and it needs, I remember in the book you talking about, if you put it in too far, it'll close around it. Like you need to have a toy that is designed for that purpose and to start to either teach your body to accept it or just be a toy that gets used for that sole purpose, but it needs to be designed
Totally.
correctly.
Totally. And I think now is probably a good time to talk about the female pelvis. Most female pelvises are actually quite good from a muscle perspective because really the female pelvis is set up to give birth. So that pelvis, the muscles that are there have much
Mhm.
more elasticity. So they're able to. So most women don't see me because they're too tight in the ass. They see me because the skin doesn't accommodate. The skin is too thin. And so when you are pooping or trying to have sex and someone is just jamming something in, that skin tears and develops what's called an anal fissure, which can become quite debilitating and limiting from a pooping
That happens with
perspective. And
pregnancy too, right? Pregnancy as well.
totally,
Yeah.
very much so. Hemorrhoids, pregnancy. I see a lot of post-pregnancy women with
Yeah.
extra tissue in the space from hemorrhoids, skin tags, or the way fissures healed. So it is very, very common in that space. But when you're using the glass toys or you're using a cone device, the cone we made out of silicone, just because it would be quite too heavy from a glass perspective. But what the cone device does is it stretches the skin more and it's working on. And I always say, think of a pizza pie. Most pizza pies have 8 slices. Let's think of all of our asses as having 7 slices. How do we get the eighth slice? We need more room
Hmm.
anally. We need the muscles to relax and we need that skin to accommodate. So by using toys, by creating very controlled friction,
Hmm.
with the glass and with the cone, what we're doing is we're setting the stage for the skin to get tougher but more pliable. And I also think about if you and I are going to the gym and we're lifting weights, we get a callus on our hand from the bar. Same
Hmm.
concept. I want a callus to develop on your skin. Specifically in certain locations, we know that most people tear to the front of the ass, which would be in most women towards the vagina or the
Hmm.
penis, and then to the back of the ass. That's just the way that the folds of the ass work. So when people come to me and they're like, oh, I tore, 9 times out of 10, I know exactly where they've torn before they even show me their ass, just because of the way that the anal actually opens, the cavity, relaxes. So that's where these toys come into play. And it's not a huge deal. Do it while you're showering,
Hmm.
alone, learn your muscles. You'll hit the first muscle, you'll come out, and the book goes over, and on Future
Hmm.
Method and my Bespoke Surgical site, all these go over all of these different protocols that you can start to tap in to learn. Okay, can I do this? Am I functionally and mentally? And then also, it's like, do I seek pleasure in this? Because
Hmm.
you may be using these toys correctly and have the right perfect ass, but you feel as if I don't feel pleasure in it. And so then the question is, well, why is that? And we go a lot more into the book so people are able to kind of figure out what they want sexually.
So, for the listeners who've never engaged in anal play, and specifically, I'm thinking of the men, probably the heterosexual men that are listening, like, "Ooh, am I going to go down this road as a recipient or as a giver?" I mean, I think this is really important if you're topping,
Totally.
in either role, but like definitely also as a recipient. So, talk to us a little bit about the prostate. Hi, I hope you're enjoying the episode. Wanted to reach out to you. This is Dr. Jen and say, hey, if you would like to deepen your own experience with this, there's a couple options. If you head over to pleasureproject.us, you will see several things. There's lots of articles. There are also merchandise items that you can buy if you're feeling enthusiastic. You want a tote bag. We've also got fun cookie cutters. You could also join the waitlist for an upcoming Pleasure Circle, which is a small group intensive that I lead. Would love to have you. If you want to know more, check out pleasureproject.us.
Yeah, so the prostate is what most people refer to as the P spot. And in women that don't have a prostate, it's called the A zone or the A spot. And
Mhm.
it's just a bundle of nerve endings in that space. Now, the prostate is about 5 to 7 centimeters inside, and it's towards, so if you think of the asshole, I always think of the ass as 12 o'clock is towards the tailbone,
Mhm.
6 o'clock is towards the penis, the vagina area. So towards the front, 6 o'clock, about 5 to 7 centimeters inside is this prostate. And the prostate is basically the size of a walnut. And what does it do? It fills with fluid. And that prostatic fluid, as we're engaging, you don't need to be engaging anally in anything. Even if you're thinking about sex, the prostate starts to fill with fluid so that when the sperm that's coming from the testicles goes through into the prostate, all the juices fill that and make semen.
Mm-hmm.
So the prostatic juices. Now, with that being said, most people don't tap into prostate play because they're not enjoying themselves anally. Now, there's lots of products that are out there now that do vibration through the outside. So if you're someone that's like, hey, I don't want anything in my ass, you can still stimulate prostate and do some stuff externally to
Mm-hmm.
get much more pleasure in that space. But when you look at why people engage anally, it is because when you hit that prostate from inside the rectum, inside the ass, you are stimulating it that much more, that those positive nerve endings create an orgasm like you've never had
Mm-hmm.
before. So direct stimulation. Now the gland is finicky. It can get irritated. And the book and I'm sure we'll go over
Mm-hmm.
why you need to be cognizant of that. But the reality is that when someone is engaging anally, the orgasm and the full on approach to it is so different that you will not have that orgasm without tapping into that. And very similar on females with the A zone, there is so much positive nerve endings, whether it's direct stimulation, whether it's translational, excuse me, where you're hitting just from anal play, you're hitting the vagina, the cervix, the uterus in a different angle. All of those things create the reasoning why people love anal play.
So, and then the perineum.
Yeah, all of that. You know, like some people are into analingus or external play or just whatever that is. The reality is that that is so sensitive. I mean, why do
Right. So
people
that's that little
under
zone between the front and the back, and
exactly?
the
Yeah.
toys would aim to hit that spot, to usually with vibration, but also certainly tactically you can hit it.
I mean, I think when people are engaging and they're giving blowjobs and playing with balls and vagina and all that stuff, that area, that licking, it's so sensitive and so amazing. The same thing if you keep going further back. Obviously, you know, again, we go into the stigma and the shame and the phobias that
Mhm.
people believe. But the reality is, if you start to kind of put this slowly into your world, you'll start to see how much benefit it creates from a sexual perspective where it'll now lead you down to what you feel comfortable with. And then obviously consensual sex with partners, etc.
Sure. Well, and in the book, I appreciate that you talked about both really practical things about like dietary considerations, but also just, hygiene and how to make sure that's happening, which often does depend on having a good diet. That you don't need to be douching or doing any of that stuff. You really can address it just through having a clean diet and regular bowel movements. And you're not going to have much issue with having like poop or anything get on you.
Yeah, I
All
think that that's one of the
never felt like
big, I think that's one of the big phobias with this. Like, am I going to shit on my partner or partners, right? Now, yes, I think that when you look at, I usually speak of gut health first before butt health. So in the book, we talk about appropriate diets and fiber supplementation, trying to basically poop like a dog. Most dogs, when you see them poop on the street, it's congealed, it's easy, they don't need to fully clean after. And that is what we're trying to achieve with our bowel movements. Because again, we want people to feel sexy and comfortable, but not to harm themselves. And so, from a listener perspective, you know, douching is obviously cleaning out and using a solution. We know that water and enemas are very damaging to the inside of the ass. They basically mess around with the microbiome, and you have a higher incidence of complications from infections to STDs to injury. So the key for me, especially with starting Future Method, was most people, even though you and I are saying don't douche, they're going to douche. And so the issue is, how do we make sure that people are douching correctly? So one of the first products we came out with is an appropriate anal douche solution that doesn't fuck with the microbiome. So it makes you
Right.
clean, it makes you sexy, but yet you're not irritating the space. And we go over less is more and how do you kind of titrate down. And that's why we talk a lot when you're doing the toys on yourself in the shower, don't douche. show yourself with the glass toys that you are actually clean 9 times out of 10, unless you had obviously a diarrhea day, a bad day with bowels, etc. But you start to learn your body. If I had this for dinner, if I'm feeling
Mhm.
this, I'm able to engage. And you start to create an environment where you're able to understand yourself. And then if you are going to douche, which I get it, then it's like, how do we kind of understand to use the right product, to do it correctly, and to substantiate less is always more, and kind of go into that route. And it goes back to understanding your anatomy,
Mhm.
understanding how you actually poop. Poop is much higher up in what's called the sigmoid colon. When we have a bowel movement, most people have bowel movements in the morning because we change the pelvic angle. So we're lying down. Now we get up, brush our teeth, and once we change the angle, that stool that's higher up moves into the rectum. You feel like you need to poop, you go to the bathroom, and then it leaves. The area where we're having run-of-the-mill anal sex, stool doesn't sit there. It sits
Mhm.
higher up. So if you're overdouching, if you're using too much fluid, you actually may create a bowel movement, which we don't want. We want to just clean
Mhm.
where you're engaging anally. So there's a lot of this that people need to think about. I think just like if, hey, I want to get into anal, it's like, okay, what can I do externally? Shower, we have an exfoliant, we have soothing creams. There's so many products from other companies that are
Well,
out
and I
there.
know there's also you have something that where you can actually get the lube in there much easier, right? It shoots the lube.
Totally. Yeah, there's lube shooters. There's so many things that are out there to support the environment. But I would say, like, for any of our listeners that are like, hey, I don't know if I want to go to full anal penetration, what do I need to do just externally? I think just
Mhm.
like you're preparing for sex any other way, showering, being specific to make sure anally that you're clean, and then making sure that, you pamper yourself in a good way that you feel sexy. And then you can start to explore just externally what you feel and how you feel. Then, if you're like, hey, I want to keep going further, now it's like, how do I get into internal play with dilating and the appropriate understanding of that, and then leading you down the path to full penetration? Whatever that is, you may just say, hey, I just want to
Mhm.
stick with toys. I don't want anything up my ass other than that. Or you go further
Mhm.
and further depending upon what you feel comfortable with.
And also back to you might just be more of a top, but you should be caring about your bottom. But
That's right, 100%. And I always say,
superstars, yeah.
totally. And that's why we did in the book these things called top tips, because I think the best tops in the world still take it up the ass and understand the right way to do that.
Mhm.
Many tops that are out there, I ask them, "Hey, would you bottom if it's not painful or bleeding or issues?" And most of them actually would if
Mhm.
they act. And so that's where a lot of what I do in my office is like, how do you evaluate which type of ass you have?
Mhm.
And then I break up into three different categories, meaning, can you do things on your own? So let's say you came to my
You have a
office.
machine though that also checks that,
Yeah,
right?
I was going to say that. Yeah, we do what's called an anal manometry test. So
Mhm.
in the office, we do a detailed sexual history. Then I look inside and out with a camera and I'm able to understand the muscles, the skin. Is there something that's limiting what we're trying to achieve? Then I have you see our physical therapist to do a test on the muscle, which actually tells me which category you are in. Now, in the book, a lot of people don't have access to this type of care. So I break it down into what you could do by using the toys to know, am I in one, two, or three, right? Now, I break up sex into kind of the three categories of, can I do things on my own? Second category is, do I need physical therapy or something in the office? And I'll explain that. And then the third is, or do I need surgery first before I start because there's something that's blocking or
Yeah.
limiting or a problem?
Right. It's
And
super.
I do a lot of work with anal Botox, which is a game
Mhm.
changer for the
Yeah.
community. And that really is super amazing. And think about those three muscles we spoke about before. Two are on the outside, one is on the inside. That internal one, that's the one that you and I don't have much control over. That's the
Mhm.
one that's really tight. So let's say I'm topping someone and they're like, I'm relaxed. And I'm like, I can't get me in you because that third muscle doesn't respond well. Now, by
Mhm.
using the toys, you're starting to create an environment where you're able to learn how to relax those. But some people, no matter what toy work they're doing, that third muscle is just not listening and or too tight. So by giving anal Botox, you could do it in the office. You don't need to be asleep. It's a same day, simple 5-minute procedure. It lasts for 3 months. You're not going to shit on the street. You may have a little bit more gas, but what it does is the pressure, it basically decreases the anal pressure by 15 millimeters of mercury. And what it does is it takes that muscle from being too tight into a normal range. Once it's in a normal range, now you could start using the toys and the dilator and the cone and be that much more effective. So people that come to
And
me
it's
and they're
not going
like,
to
it's
relieve any
too
sort of
painful.
sensation. It just
No,
helps.
no, it's going to actually enhance your sensations
Yeah.
because you're going to diminish the pain sensation side of it to give you that approach. Now, Botox itself, it's not usually a one and done solution. Most people do it 2 to 3 sessions, and it's every 3 to 4 months. And think about like those mailers. I always say like a restoration hardware catalog that has, excuse me, that has those big rubber bands. That's what this is. Sometimes when you try to take that rubber band off, it's very difficult to do that. So by giving you Botox and then allowing you to start stretching, over time, you're allowing that rubber band to learn how to become more elastic. Does that make sense?
So I'm just thinking about my listeners going, are they like, wow, this is really advanced? Are people sheepish coming in for this? I mean, again, if they haven't, if they've been having a lot of anal play, then it's probably a different population. But
I think it depends. There are definitely people. I think most people are going to Google and going to
Mhm.
podcasts and going to learn before they come into the office. I find that, again, there are definitely people that come in with their head down a little bit, but then I take the lead to break the stigma and have these conversations in a way that just is like, hey, it's all well and good. Like, how do you want to live your life? And how do I help you do that? So I think that it's having more of these conversations. So I
Yeah.
always applaud, you for doing
Mhm.
what you're doing, because at the end of the day, it allows people to just start feeling more comfortable with things. And
Yeah.
then
To
once you feel
non-binding.
more comfortable, yeah,
Mhm.
you're able to just be, and I couldn't care less. Like, to me, I'm like super easy. Like, I want to meet people where they are sexually, and I am here for any question. There is no stupid question. The only stupid one is the one that's not being asked. I don't care about anyone's kinks or stigma, taboos and all this stuff. It's like, great, let's just like work on it to figure out how to make it just conversational and easy for people to
Do
get to where they
people
want.
bring their partners to appointments ever?
Sometimes, for sure. Yeah,
Yeah.
yeah. I think one of the things, and you bring up a good point, I think one of the things for that I see is that if you have the makeup in your mind that you want to engage anally and you
Hmm.
can't physically or mentally, it ruins yourself. It can ruin you. It can ruin relationships. I have seen people from all over the world that are suicidal or have lost their long-term relationships because they can't engage anally. Many people started out when they're 20s, they were able to, and then something happened, an injury or some limiting factor that now
Hmm.
makes them not able to bottom. And if you want to take it up the ass and you can't, you will do everything that you can, find a solution to that. And so
Yeah.
now having a place, having a book, having people talk about it, what we're doing is we're setting the stage for people to now say, yes, this is really important to me. What can I do to seek the help, the guidance, etc., to get there?
Do you see people, I'm just thinking from the psychological standpoint when that's a big factor. Do you see people coming in who, when you do that machine, it shows that they actually should be receptive and they've got like the physical body to do it, but they can't, which would indicate
Totally.
that it's psychosomatic? Yeah.
I think that I always break the S into three different components. One is like the functionality of it.
Hmm.
Two is the neuro connection, the brain to the ass. And
Hmm.
then it's the mental, psychosocial, right?
Hmm.
So those three components play huge into it. And like when I say like I do surgery, I always tell people I'm 60% functional work, 40% mental work.
Hmm.
Sometimes I give anal Botox to people, they meet the requirements from an anal perspective to be able to have anal sex. Something happens, someone's entering them, and they clamp down because reflexively they're nervous, they're in their head, their situations.
Hmm.
So there's so many things that go into this when we say, hey, yes, you may have the perfect hole mechanically, but yet functionally and psychosocially and mentally, it will not allow you to do what you need to do. There's so many things that we're doing
It
here
kind
to
of reminds me
unpack.
of like vaginismus or something, where it's
Yeah.
like involuntary, kind of holding and spasming. Hmm.
And also, if you think of anally, the reflex of the ass is to make shit, right? Is to
Hmm.
poop.
Hmm.
Now we're going the opposite way. We're going the
Right.
wrong direction. So when you say that, it's just because the mechanism there isn't set up for that for 2/3 of the people. You
Hmm.
can train yourself to get that mechanism in the right space. Now, and then again, there are plenty of people, women post-pregnancy that have hemorrhoids or fissures, and then I need to surgically first get rid of those. Because think of a pipe. The vagina, for the most part, is a pipe, and there's nothing blocking it.
Hmm.
Now, if I put a hemorrhoid or I put skin tags or this, think about now the pipe has things that cause friction. Well, what happens? Now I become tighter. If anyone has ever had a hemorrhoid, they're like their muscle gets tighter as a
Yeah.
response to that. So now think about all of that as it relates to not only activities of daily living, shitting, Peloton, exercising, squats, all those things. Now we're adding anal into that. You
Hmm.
start to see that there's a lot more that goes into it than just muscle and skin. But I try to break it down for people to kind of really just figure out, how do I just get to the pleasure side? Let me worry about all the other stuff. But I
Hmm.
think it's the key is by being very gradual. When people get injured, they go from nothing to something big, or they go from nothing to something
Yeah.
forceful. But if we're going incrementally over time, what you're doing is you're now setting the stage for that success. And that's where I talk about after you've done 6 weeks of the protocol, and if you're like, hey, I've taken everything, small toy, medium, I've been the cone, I feel comfortable, I'm able to get off and have fun with it. Now I want to actually engage. Now it's finding a top that knows the right ways to actually engage,
Yeah.
or just having them sit there and you get them hard, or you have their strap on, whatever on, and you are using them as a dilator. And in the book, we talk about the right first sexual positions, facing each other, being communicative. Basically, you're in control the first couple of sessions so that you're able to be using the toys right during sex or before sex. You're
Right. You know your
pre-dilating,
own body
you're
because you've already been.
opening up
Yeah.
already, you're lubricated, and you're then sitting on them in control. And then you could start to kind of go through different positions. And in the book, we label them as one peach, two peaches, and three peaches as a rating scale so that people know what's more advanced from a positions perspective, especially from an anal perspective. And again, really great points for bottoms, for tops, for people, everybody to kind of understand the anatomy and how it functions, and then for them to be able to set the stage for that success.
What typically is the easiest position to receive anal sex?
Usually it's on top, just you sitting on someone, facing them in control, because it's very similar to how we want people to do the dilators. I like people standing when you're doing the dilators. When you're
Hmm.
standing, you're actually able to get much more relaxation in the
Hmm.
anal region because your structure of the glutes and the core is keeping the entire body aligned, and then
Hmm.
you're able to relax the anal. So it's the same side. Some people do, the problem is if someone gets behind you, you're not facing them, they can't see you're grimacing, they can't see you, and it winds up setting that stage where, again, yes, it feels amazing, but now, and even in the book, we have you think of like, well, is the dick pointing up or is it down? What positioning are you? How tall are you? How is your positioning? Is it on the bed? Is it not?
Right.
And it goes into all of these different things that you need to take into account. But hopefully, by you using toys and getting into the routine, you could then start to kind of do those positions on your own where you're able to be like, wow, doggy style feels really good for me. but yet if I'm on top, it doesn't. And then you're like, well,
Mhm.
why is that? Well, maybe they're hitting the vagina in a weird angle. Maybe they're hitting the prostate too much. Do you need to move up on that person? Do you need to move back? And this doesn't apply to just anal. I don't think we talk
No,
about this in vaginal, in oral sex, in
it's
shitting.
true. There's a
It's
bunch of
like,
variables. It's like,
right.
yeah.
Now, like, even if you guys, anyone that's listening is not getting into anal, like, just thinking the way that I think on a scientific side starts
Mhm.
for you to think about sex differently. And again, the first time we're engaging sexually with someone, it's kind of always a little bit awkward. It always
Mhm.
takes time to build that rapport and create an environment that makes sense. Think about how many people never engage anally after the first bad experience
Yeah.
because they weren't taught, they don't understand X, Y, and Z. And think about how many of those people would actually benefit and love having anal sex into their space, but yet are so deterred because of the first failed attempt because they went from nothing to someone behind them, right? That's why this conversation is so important for
Well,
everybody.
and you mentioned several times to use copious amounts of lube. Lube is
Yes,
critical
yes,
with
totally.
anal play. Yeah. Lube is always your friend, but definitely with anal. Yeah.
Yeah, because the ass doesn't self lubricate. Some
Yeah.
people think that it does, but those people are either over douching or have an STD. So you
Mm.
just got to be careful as it relates to that. But with that being said, ton of lube. And I think that's where the lube shooters and using the toys before or during sex and not feeling uncomfortable to bring toys into sex so that
Mhm.
you're able to set the stage for that success. Those are all the things. Lube shooters are basically these syringes that you shoot lube up higher, up
Mhm.
into the ass, so it kind of lubricates the entire canal. So a lot of people, you could either use a lube shooter or some people just use the toys where they're just
Mhm.
taking the toy out and reapplying and going back in and out so that it kind of sets the stage. Remember, it's a tunnel and that tunnel needs to be lubricated 360 degrees around for the length of whatever we're inserting. That's where we talk about it and we go further in the book of like what type of lube, how to do it, how to make sure you're
Mhm.
placing it correctly and setting again that stage.
And you mentioned in the book, and I have heard this clinically, that sometimes when you're receiving anal sex, some men and some men do and some don't keep an erection.
Yeah.
That's
Yeah.
normal.
So very cool point. So the ass, it goes back to which type of ass you have, because
Mhm.
there are many people that are too tight anally, and but that tightness anally helps keep their erections, or that they shoot and they're ejaculating really far or much further because they're squeezing their ass, they're squeezing their entire pelvic floor. So even in women, when you think of regardless, the pelvic floor is like a basket. It's like a weaved basket.
Yeah.
And the ass, the vagina, the penis, the testicles, they're all connected in that weave. So for some, they get super, super hard because the entire basket is contracted.
Mhm.
Others, the basket is only contracted, the testicles, the front side of the basket, but
Mhm.
anally, they're able to fully relax. And that's where you start to learn where, first of all, there are definitely bottoms that enjoy anal, but they don't get erections and they don't get hard and or get off. They're getting off because of someone inside of them, the pleasures
Mhm.
that they're seeing, and then after they get off the way that they want to. All of this is
And that
related to
doesn't
what
mean
type?
that they don't like what they're doing. That doesn't mean they're not
Exactly.
enjoying the experience. It's just physiologically what occurs for them.
Totally. Other people are able to stay hard with someone inside them anally, but yet they can't ejaculate in that
Mhm.
way. They need
Mhm.
them out. Why? Because that anal muscle is important for them to fully ejaculate. So
Mhm.
there's lots of different pelvic makeups that make this up. But again, that's where you have to figure out who and what you are. Now, I do a lot of anal Botox, and one of the things I tell with anal Botox is you may not, for some of these guys, you may not be as erect as you were, or you may not shoot as far. Now, most of those people, there's no difference because they're already so tight that by
Mhm.
bringing their pressure down, they don't really notice it other than that their ass is a little bit more relaxed in a good way.
Hmm.
There are certain things, and that's why we do the testing in the office and we kind of come up with a plan. Sometimes instead of doing a full dose of Botox, I do half a dose to see how it fares with urination, bottoming, with all these different
Sure.
types
Yeah,
of
all your
sex, because
functionality.
we want to make sure that we're doing all the right things to, again, make sure it's exactly what we want.
Right. So, where can people find you? I know you're in New York City. Are you ever on the West Coast?
I used to be in LA, but it was such a schlep and with COVID and all that type of stuff.
Hmm.
So I'm now just in New York. I'm in Manhattan. I'm on 12th Street, but you can follow me. Bespoke Surgical is on all the handles. Me on Instagram is Dr. Dr. Evan Goldstein. The brands we were speaking about, Future Method, futuremethod.com or at the Future Method. That's one. And then But Seriously, you can get it on all of the different modalities, butseriously.com. And, I do a lot of Zoom calls. You can DM me. We can, there's many ways that we can set the stage for success. I think one of the things is and if you buy the book, you're able to kind of, again, figure out who you are first. And
Yeah.
then to say, like, hey, I may be able to be successful if following A, B, and C, that I don't need anybody, or know that there are certain things, and how do I do things to be successful in that. So I'm available. The book's available,
Great.
obviously, and whatever you need from me, I'm more than happy to help.
Well, thank you so much. Really helpful. I'm guessing many people have. I told several people I was going to be talking to, and they were like, "Ooh," and I was like, "What questions do you have?" Everybody's got questions in this arena, so having a consult can be really empowering, I'm sure.
Yeah,
So,
I appreciate it. And I think that this is super powerful for people to hear. Even though we're talking a lot of jargon, it is
mhm.
straightforward, it is sexy and amazing and pleasurable, and it should be brought into, I think the world would be a better place if everybody was into anal.
Nice. That's your quote. Okay. Well, thank you so much. I really appreciate everything you've given us today, and we'll
Thank
definitely
you.
put the links in the show notes.
All right, thank you.
Hey, it's Dr. Jenn. Thanks so much for tuning in. Please leave us a review and leave a comment if something struck you. We'd love to get the feedback. It really helps the podcast. And if you want to reach me, go ahead and direct message me on Instagram, or you can reach me at jen@rivieratherapy.com. Thanks.